practicing Brahma mudra, what will happen? Or when you are doing right, left movement or circular movement in a short span, there may be little confusion to this vestibular apparatus, whether to bend on right side or left side. And that is why sometimes you may get giddiness when you are practicing Brahma mudra with open eyes. That's why I told you, you keep your eyes closed when you are practicing Brahma mudra, so that the danger of developing giddiness will not be there.
Sir, Brahma mudra
Anybody else?
reduce vertigo?
Yes, yes. Now, why vertigo is there? Because these cervical vertebrae, if there is a difference, the space between the two vertebrae reduces, there will be pressure on the cervical vertebrae, cervical nerve, and where that nerve which is supplying to the hand or to the part of this, it will get compressed, and then you will get cervical spondylitis or pain into the neck and going to the arm. So that can be reduced if the space between the two cervical vertebrae is maintained. Your cervical pain and vertigo will go, if it is because of this.
Thank you, sir.
मुझे भी बैकवर्ड बेंडिंग के जो आसन है ना, जैसे अचानक से भुजंग आसन कर लिया, मार्जर कर लिया सिखाते वक्त, तो वो टाइम पे मुझे भी चक्कर जैसा होता है, या अचानक से मतलब बैठी हूँ और खड़ा होना पड़े मुझे, तो वो टाइम पे भी चक्कर आता है, तो वो भी वर्टिगो का है क्या?
It is because if you change any position suddenly, so body gets less time to get adjusted with that, and that is why sometimes you feel giddiness. That's why I told at the initial in between somewhere that you are sleeping in the night and morning you hear the bell that milkman has come. So suddenly never start walking because your muscles are sleeping, so they are not alert. So first make movements in the body itself, make hand movement, leg movement, take it near, take it, stretch it, so that all muscles are alert, they are put in alert mode, and then they will contract properly. Otherwise, sometimes what happens, you must recollect that you are sleeping and your bell rings and suddenly you get up. And what happens? Suddenly you get, oh, then you try to support yourself and then slowly you can walk. Why? Because the muscles have not got up from the sleep, and that is why they cannot perform the action properly, and that is why you feel, oh, I cannot walk. So that is why you should make first movement. You make all the muscles alert by making movements in the body itself. Similarly, if you are doing bhujangasana, that is why whenever we are doing asanas, the first principle I told you, you should not do it with force. Balapurvak karega to balahani hogi. Then second thing, when I will go to that part, I will be teaching that part also. Never practice any asana to the last, the final stage in the first go. Because if you try to practice in first go, suddenly, suppose you are practicing bhujangasana. So first you do Ardha Bhujangasana, Sulabh Bhujangasana. Let him do it for 3-4 days. Then you ask him to go little up. Then you ask him to sit to the ceiling. So if you go slowly, you will not feel that problem.
Thank you, sir.
Sir, Agni sir, they say to do only 7 to 8 times like that. Only practice, serious practitioners can do so much, isn't it? We cannot do so much. 100 times, example.
See, that is why I told, as a beginner, you do it for 5 to 10 times. Now, once you come into the regular practice and then you become a permanent doing yoga practices, then slowly you can improve it, increase the number. Once you become before you become yoga teacher, you did the suppose foundation course. So what happened that time? You started slowly, and all the people who are practicing this yoga, they are not patients. They are healthy people, isn't it? So you can slowly increase it and go up to 100.
Yeah.
And that is why I always said, बलपूर्वक करेगा तो बल हानि होगी. यदि तुम 3-4 बार करने के बाद आपको ब्रेथलेस लगा तो स्टॉप इट देयर ओनली.
And in varicose veins, serious varicose veins, already when it is formed over there, it will not come up. Will it? How will it come up? How the blood will come up from the veins when we do Agnisar? Exactly.
Again, it create a negative pressure. That is how the blood will be sucked up. I have shown you, na, that segment.
Yes, yes. But the veins are gone down already. So how will the come up? Suppose the damaged veins.
Yeah. See, whenever there is a negative pressure anywhere, now the water, air will flow from positive pressure to negative pressure, isn't it?
Yes.
Similarly, when there is a pressure on this vena cava, the blood is pushed up. So there is a negative pressure over here. So because of the negative pressure, the blood will be sucked from this to this segment. So this will act as an additional force to pull the blood upward. How the water from the basement tank is lifted up to the overhead tank? It is by the motor, na? Electric motor. So what it does, it creates a negative pressure, and that is how the water is sucked from lower segment to the upper segment.
Okay, sir. Even if the walls are down, the blood will come up. Yes.
Yeah,
okay.
because of negative pressure, it will be sucked in.
Mhm.
Negative pressure itself sucks the blood up.
Okay, sir. But I feel that the walls are going down, so that will block the bad blood. It will block the blood. So, isn't it like that? It's not like
No. The wall which is open here, it is not closing properly. So it remains open over here. So the blood can go up. No? It is
It
not
will go up.
totally closed. It has become weak, lax. So it remains open all the time.
Okay, it will remain open.
But the who has developed very bad varicose veins, he will not get totally cured with the help of Agnisar. That you remember. It will only help to arrest the progress of disease. जो नसें एकदम बड़ी हो गई है और ज्यादा बड़ी नहीं होगी. He will require additional medical line of treatment. Agnisar will be adjuvant only.
Okay.
सर सर्वाइकल के लिए आपने ब्रह्म मुद्रा, भुजंगासन और 2-3 बताएंगे, प्लीज रिपीट करेंगे सर.
वो जब बैक पढ़ाएगा ना तभी बताएगा. सर्वाइकल स्पॉन्डिलाइटिस के लिए ब्रह्म मुद्रा है, भुजंगासन जो है बैक के लिए, सियाटिका उसके लिए.
Sir, if a person has a gastric issue, so that time Agnisar and Udyan Bandh will help. And is it required that the stomach bowel should be clean when the person is doing Agnisar and Udyan Bandh?
See, the first question itself is wrong. If somebody has got the gastric ulcer, he cannot perform Agnisar.
No, not
Second
gastric
thing,
ulcer, sir. Not gastric ulcer, gastric, वो गैस जो बनता है पेट में, sir, that.
He can practice Agnisar, but basic principle for practicing yoga is your stomach should be empty. So for Agnisar also it should be empty.
Yeah, sir, but sometimes happens कि वो नहीं, कई लोगों का सुबह नहीं होता है, so it takes time for them, even if they are practicing for a long time. So
once they have passed motion, the gases have come out, then only they should practice Agnisar.
Okay, thank you.
Sir, recently one of my students is doing gymnast, but they have been told not to do this neck rotation. is saying that it's almost getting banned in that field of sports to do this kind of rotation exercise. Is there any research or anything you know about that thing?
You ask him only why he is banning it. What is the reason? Now I told that when you are practicing Brahma Mudra, you should keep your eyes closed. I have given you the medical explanation. Similarly, if he is telling that it is a ban on that, ask him what is the reason of the ban and what is the research they have done on that.
Okay. And another thing,
Only
sir,
thing what some
yes,
institute they give the Brahma Mudra third type. The first type is just gentle movement on left and right. Then second is bending on this side. Then third is rotational. And fourth they give thrust, like the jhatke ki karte hai iske. That is agreed that you should not practice. But normal Brahma Mudra first three types you can practice.
so another thing, sir, like the exertion. Some people like the pit category jo hai, or kapha, and some young people who have very high energy, they don't feel good after doing yoga. Rather, after full exertion, they feel better. They feel much more relaxing. So in that approach, whether I can go for that approach for the young people or who have this extra energy for, I mean, as per the category, is that okay for going for exertion, or should we go for the this conservation method for everybody?
See, while practicing yoga, you are making elastic body and with the minimum energy expenditure. Such person can exertion means he can work a long time. Suppose he can work 12 hours, 18 hours also, he will not feel tired. So that is how the energy expenditure will be there. But if you practice yoga, the conservation is there, maintaining the elasticity of the body is there. So he can work for more time.
Okay.
As you see, the Prime
Okay,
Minister is practicing yoga and he is working for 18 hours a day, 20 hours a day. How? When he is working for 20 hours, the energy expenditure is there. So he is able to work so much time with the minimum expenditure of energy because his body is elastic by practicing yoga regularly.
Got it, sir.
Sir, one more thing. If the energy is more, they can go for Surya Namaskar also. Sir. If you feel that there is...
See, if you are practicing yoga and if energy is more, you can work for long time. Na? You may not get tired in 8 hours work or 10 hours work. You will work for 18 hours also, no problem.
Actually,
because
sir,
it will improve the efficiency of the all organs. Yes.
Time restriction is always there in the modern life. So HIT is one of the form of exercise became very popular. Shortest period of time, maximum benefits comes all over strength and also the stamina. And there, one thing is claimed that the VO2 max जो है volume of oxygen intake वो बहुत improve होता है HIT, the high intensity interval training जो है वो aerobic and non-aerobic pathway में shift करता है body का energy. So that can be done.
See, that is whatever aerobic, anaerobic you are talking. These are all only having effect on muscles. In yogic practices, if you are practicing asanas with the yogic way, it is also improving at the mind level. So the sympathetic, parasympathetic balancing is there. Then it improves the lung capacity, alveolar efficiency. The oxygenation is always improving with the help of yogic practices. Muscles practices, the aerobic practice, what will happen? It will only act on muscles. So the muscles will be overworking and they will be giving more burden to the respiratory system and heart system.
Okay. Got it, sir. Thank you, sir.
Welcome.
Anybody else for the question? Or we can end the session.
Yeah, I think it is 8:50 now, quite a bit.
Yes. Chant 3 Omkaras and 3 Shantis. Sit erect, see that your eyes are closed. Take deep inhalation. Om. Shanti, Shanti, Shanti.
Hari Om.
Hari Om, all of you. Thank you. Thank you, sir. Thank you very much.
Hari Om. Thank you, sir. Thank
You
you,
too.
sir.